Hey, let's welcome to the microphone Dr. David Klein of the Stages of Life. And as you travel around Central Florida, you travel all over the place, you're starting to hear something almost everywhere you go. And that is not just a cough, not just a, no, you're talking about a chronic cough. I mean, one that you tell just isn't going to stop. And some of those people, it's almost debilitating. But the fact is, they're not going to the doctor, and it's getting worse. And this is something that can also translate to other people if I understand it right. So, doctor, chronic cough can be bad.
Well, this is kind of an interesting problem right now, okay, and it's nothing new. There was a study done some years back by Johns Hopkins University where they looked at chronic cough, chronic bronchitis. What's chronic bronchitis? It's a cough that's lasted longer than 6 weeks, all right? Well, it can be caused by lots of different things. Smoking is a good example. Allergies might be another. But 1/3 of people that have a chronic cough, it's a cough that won't go away, tickle in the throat, cough, 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 could well be due to something called Bordetella pertussis or Bordetella parapertussis. You're going to start to glaze over. What's he talking about? Well, you might know it as something called kennel cough or whooping cough. It's the same bug. Okay, in dogs, you treat them because after all, you hear the dog barking, the barking cough. Well, in a dog, it's kind of like reasonable that a cough should sound like a bark. It's not so reasonable in people. The problem with Bordetella is it's infectious. Okay, now, children, infants, and elderly in particular, those with compromised immune systems, are at risk for catching this from you. That's bad. Okay, that's bad enough. That's reason enough to get yourself treated. You'll see public service announcements on the TV right now from the Center for Disease Control in Atlanta, the CDC. The wolf at the door, Bordetella. Okay, here's the real problem with it, is that Bordetella is existing in your body if you're so infected, but it excretes, it dumps out a cardiotoxin. Okay, it damages your heart and it can damage the nervous system. So it's very, very important to clear this thing out. Okay, I've had patients come through where they've had the chronic cough and something called autonomic dysreflexia. Well, that must be coming from their diabetes. What if they're not diabetic? Well, it must be coming from some kind of toxin. What if they weren't exposed to something other than what's in their lungs right now? Well, how do you diagnose it? Well, you can do certain types of serology, or you can listen with your ears. It's a very, very characteristic barking cough, and frequently, not always, but frequently, people with this will cough. They'll cough like crazy. The sputum that comes up is extraordinarily thick. It's like maple syrup, and they'll cough until they vomit or cough until they want to vomit. Okay, that is the hallmark of whooping cough in an adult. Now, whooping cough is not a disease of infants. When it is, it can be fatal. When it's a disease of people that are not infants, it can become incapacitating. It can be debilitating. It's very, very important. Now, you're going to think, rightfully, well, gee, I had a whooping cough inoculation when I was a child. Well, guess what, Einstein? Okay, these things only last 7 to 10 years. So if you had a tetanus injection 15, 20 years ago, you'd know that puncture wound to your hand, the chainsaw, whatever happens to have, you're going to want to have a tetanus shot. You're going to know that your flu shot only lasts for 1 year. You're going to know that your pneumonia shot may last for 2. Your zoster, your shingles will only last for 7 to 10 years. These inoculations only last so long. Few of them last longer than 10 years, okay? Whooping cough is one of them. So the first thing that you want to do, if you know somebody that has one of these coughs, is to gently point out to them that they may well have whooping cough, and it's treatable very, very easily, very inexpensively, but it does need to be treated by a physician.
Well, in my case, and I'll admit that we're kind of talking about something that was recent with me, I was sitting in your office for yet a totally different call. We were there to discuss something different. But you were down the hall, and you heard me coughing and hacking and everything in one of the appointment rooms, and you came right up there and said, "Hey, you doing anything about that?" Well, I knew it was. To me, it was a heavy cough with a lot of phlegm and a lot of pain, but I wasn't there for that reason. Well, but I sure learned how important it was.
Well, it didn't take long to straighten it out either.
No.
Okay, so the way I prefer to treat this may differ a little bit from the CDC's recommendation, but I've been doing this a long time and it seems to work. And with a single daily dose of doxycycline, you do this for a 15-day cycle with a repeat at the 16th day for another 15 days. It takes about 30 days to clear this. Now, they're going to come back, well, what about a Z-Pack? It doesn't ever work. It's a 5-day course, but they always repeat it 2 or 3 times, which makes no sense whatsoever. Doxycycline taken once per day, 100 milligram dosage, straightens it out after about a month. Now, why is this important? Because the pertussis bug is not easily cleared. And when you take an antibiotic for a short period of time, it's not around long enough to clear it. Now, what else do you have to take? And this is very, very important. If you had an abscess on your arm, an abscess on your leg, or an abscess any place in your body, what does it take to treat it? And the answer is let the pus out. It goes back to Hippocrates. So the pus has to disappear. When you have bronchitis, you have purulent material, you have sputum that's infected, you have cells that are infected that are sloughing off. In order for this thing to get cured, to be treated, they have to get out of your body. So what does it take? It takes a combination of antitussives and mucolytics. Now, what's a mucolytic? A mucolytic is something that thins these secretions. So what I found works particularly well is a combination of N-acetylcysteine, sometimes known as NAC, with guaifenesin. You take 1 tablet of each 3 to 4 times a day, and you do this for a month or 2. All right? Now, is this overkill? No. Is it necessary? Yes. Will it make you feel better? Absolutely. And you'll get the junk out of your lungs, and you're going to start feeling more like your old self again. It's going to happen quickly. Now, what do you not want to take? You don't want to take something that's going to slow the cough down. Okay, so dextromethorphan, DM, the DM on the cough syrup is really bad news. Opiates are not particularly useful here because you really don't want to lose that tickle. You need to get the junk out. A couple other tricks you want to do, and this is sort of weird, but it does work, is you get in the shower. You take a cloth, put it over your face, and let water hit it. Now, if you're being tortured, they'd call this waterboarding. But if you are careful about what you're doing, you breathe humidified warm air, and it will loosen the secretions up so you can cough them out. Very, very beneficial. You're going to want to do this once or twice a day. Does it work? Yes.
And I remember when we were talking about this one-to-one, you said, when you're coughing this stuff up, do not swallow it.
Spit it out.
Get it out.
Yeah, you don't want to be transferring the infection to your gut. Does it happen often? No, but it can happen. So you want to cough this, spit it out. Now, what else can you do for symptomatic relief? Okay, so you got you're getting 2 mucolytics. Okay, very, very important. 1 strong antibiotic. Now, it's going to give you diarrhea. It's going to upset your stomach. Suck it up, Buttercup. You got to do this because if you don't, you're going to die. It is not a good way to go either. Now, why? Because when you end up with pertussis like this, it can result in pneumonia, and that's 3 days and you're gone. Okay, so this is a very, very important thing to look at. When you see that ashen color and you're coughing like crazy and you're coughing until you want to puke, that barking cough, you treat it immediately. Now, colostrum. Capsules of colostrum 2 twice a day is a slug of gamma globulin that speeds the process up. What else do you want to take? Licorice root extract. Licorice root extract will give you a bump of energy, but also kicks the adrenals up, which helps your immune system. Echinacea golden seal, twice a day. Very, very beneficial. But at the very least, the doxycycline, and once you're done with it, when the doxycycline is completed, once that last tablet of 30 is gone, that's when you start your probiotics. Why? Because if you don't, you're going to have diarrhea for a long time.
Well, and we've only got about a minute left, but I did want you to really emphasize, too many people are taking the antibiotics, and they start feeling good after about a week, and they just put the bottle away.
Yeah,
that's not good.
Very, very foolish. I mean, so you need to be on this stuff for a full 30 days. Now, the reason for the 15 days with a refill is really more the pharmacy and the insurance companies. They may not fill 30 days at a clip. So to get around this, you do 15 days with a refill, and it works just fine. Now, doxycycline is sort of an odd one. There are certain doxycycline salts which should be inexpensive, but these days you never really know. So I tell the pharmacies to, on the prescription, specifically, if there's a less expensive doxycycline salt, to substitute it per patient request and/or insurance request. Why? Because it really doesn't matter. There are many different doxycycline salts. Some of them are expensive, some of them are cheap, and I'm not smart enough to remember which one's which. So it should be a $20 medication, not a $300 medication. If they come out at $300, you need to ask them to go back and look at their red book and find the better one.
All right, very good. Robin, the doctor was discussing licorice root and some other great supplements, and I know where we can get them, but do you?
Stages of Life. Our phone number is 407-679-3337. Our website is stagesoflife.net. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our office hours and health store hours are Monday through Thursday, 8 to 5. And you can also find us on Facebook at Stages of Life Medical Institute.